Good morning. You are tuned into the Social Show, your one-stop shop for all things CSI and much more. My name is Lifebouy and I'm coming to you from our studios in Melville, the art and bohemian capital of Johannesburg. We're going to have a lovely show today, starting with the latest CSI news, followed by an interesting guest, hopefully if he does answer the phone. And we'll most likely have you thinking and just really getting into the day and starting to really find out how you can contribute to your community and to your organization. But without further ado, let's get straight to the headlines. More than 1.4 million people in Angola, including many children, have been affected by the chronic drought that has increased the risk of disease, a UN report has said Wednesday on the 17th of May. 7 southern regions of Angola are affected, with 3 border provinces of Cunene, Namibe and Hula hit with the national average of 1%. The report said that El Nino weather phenomenon has resulted in significant food production losses of almost 90% in some areas. The nutrition response remains critically underfunded, it added. About 1.42 million people, including over 700,000 children, have been affected nationwide by the shortage of the rainfall. As the dry conditions batter the southern parts of the country, recent heavy rains in the north have seen the spread of cholera that has killed almost 18 people. The cumulative number of suspected cholera cases stands at over 300,000. In total, 18 deaths have been reported. Drought has been ravaging large parts of southern Africa in recent years, disseminating crops and water resources and leaving millions dependent on aid. Namibia, Swaziland, Zimbabwe and South Africa have been among the worst affected countries. In other news, the city of Cape Town has announced the appointment of Craig Keeson as its first Chief Resilience Officer, the CRO, as part of its 100 resilient cities, 100 RC. The announcement was made during the city's resilience agenda setting workshop. The CRO position was created to lead the city's resilience efforts and to engage with stakeholders, resilience experts, and 100 RC staff in developing a comprehensive resilience strategy. Keeson's appointment as CRO has been officially endorsed by Council. Keeson's designation as CRO is an addition to his existing duties as Executive Director in the Directorate of the Mayor. He will not receive any additional remuneration in his position as a CRO. Keeson has fulfilled a number of senior strategy, policy, management and communication roles during his 6 years in the city administration, and he has also advised a number of metro governments. And now, lastly, in our news, the finalists of this year's Women in Construction Awards have been announced. The initiative aims to celebrate the achievements of women within Africa's construction, cement and concrete sectors, in addition to recognizing organizations that support and contribute their development in the industry. The winners will be announced at a gala dinner on the 24th of May, which is today, at the Gallagher Convention Center, Johannesburg. WICA is segmented into 8 categories to cater for female contribution across the broad construction industry spectrum, says awards director Atimioli. The sheer number of nominations received from around the African continent has been overwhelming, and this positive response is a testimony to the many successes in the industry deserving recognition. Very interested to find out who's going to be winning today at the Women in Construction Awards ceremony. That ends off our news.
Have you ever thought about the power of social media? Social media has the power to make your business grow. Yeah. Why don't you let us manage your social media? Because our business is to see your business grow. Visit us at www.beastownmedia.co.za. Have you ever thought about the power of social media? Social media has the power to make your business grow. Yeah. Why don't you let us manage your social media? Because our business is to see your business grow. Visit us at www www.beastdownmedia.co.za.
If you're a big supporter of Unilever like I am, you will know about their amazing hand washing campaign, which I think goes beyond CSR and saving lives. It really is one of those really amazing initiatives that have helped not only reach disadvantaged communities, but also teach people about the essence and the realities of not washing your hands. I think it's so important, and it's something that I overlook sometimes. I think I do wash my hands as much as I can when I go to the loo and that kind of stuff. But when it comes to just like regular hand washing when you after eating or doing something, using your hands in any way, I find that I don't necessarily do it as a routine as I should. And they've launched so many of these amazing, I know there's a high five for hand washing campaign. There's a lot of beautiful things that they've done to celebrate clean and confident hands. And Lifebouy sort of encourages and challenges the public at large to contribute to global hand washing day, raising awareness of importance of hand washing, and they always try and find ways in which they can get people involved and people just getting into the routine of cleanliness and hygiene. And I think it's so important, especially when people don't have access to that information. And today we will be speaking to Assistant Brand Manager for Lifebouy, which is Bhana. Hopefully he'll answer the phone. I'm still trying to get a hold of him. So we're going to just be speaking about the general how Lifebouy has really been one of the main, catalysts in ensuring that people have access to information about hygiene, about the importance of washing hands, the importance of being clean, the importance of being hygienic. And so we're trying to get, hopefully he's listening so he can perhaps just accept our call. We've been trying to get a hold of him since the beginning of the show. And so we'll be talking a little bit about Unilever's strategies. And I think the Unilever brand has really done its part in really trying to launch amazing initiatives. But more than that, I think it has this collaborative spirit. You've got Lifebouy, you've got Domestos. I was at the Oma Ready for Life campaign on Friday last week, and they were also trying to make sure that kids they have a maths campaign where they get kids in underprivileged schools or in underprivileged areas in all over South Africa to participate, and when they win about 10,000 rand, which goes into their studies. And I think again you see that with Unilever brand stretching across. I know they had a really amazing sanitation campaign which I attended last year. So many great collaborative methods of getting people not only access to good information about hygiene, but more than that, I think it's such a beautiful way of including those who may not be included in the conversation of dignity, in the conversation of education, in the conversation of just making sure that more people are use these little ways of really getting themselves to be more healthy, to be more amazing. I know their commitment to hand washing behaviors have gone everywhere in the world, not only South Africa. It's Kenya, it's India, it's a lot of things. The program sort of encourages people to adopt hand washing behavior, especially in the 5 critical occasions, which is before breakfast, lunch, dinner, after visiting the toilet, and during the daily bath. And the program has reached a lot of schools, over 1 million people across every, I think, corner of South Africa. And we are so excited to be talking to Mohammed a little bit later on the show. I don't know if you have any questions or any queries for Mohammed. If you want to get involved in this conversation, please don't forget to go to social-tv.co.za. We can help you sort of air a story. We can also make sure that you are well informed about how you can get in contact, or how you can get involved, or how you can get your kids or your school involved in these Unilever programs. You can also Instagram me, text me, DM me on Twitter, and just tell me at View for Real what it is you'd like to know about Mohammed, about Unilever, about Lifebouy as a brand. If you have any of those kind of questions, you have every right to call me right now and let me know about whatever is on your mind about our guest today. I'm still struggling to get him on the phone. Hopefully he will answer at some point. But yeah, I'm very excited to be speaking to him. In other news, I know I spoke a little bit last week about the EpiPen injector and how it failed, and it really scared me in a lot of different ways, because I was just thinking about sitting and thinking about how many times people have died at the hands of faulty medical devices. It's no secret that medical errors are actually one of the leading causes of deaths in not only the United States but also in the rest of the world. 250,000 people every year are most likely to die because of something wrong with it could be, there's so many different ways. It could be something wrong with your experience in the hospital, something wrong with your experience within a specific tool you're supposed to use that's medical. So there's a lot of different things that have happened that have contributed to the deaths of people, and most of them are preventable. That's the shocking part, that the harm is preventable. So in an effort to sort of help consumers become their own patient advocates, I've also compiled a little list of a few mistakes that hospitals make and how you can contribute to preventing them. First of all, if your identity gets mixed up with someone else's, you can get the wrong medication or even the wrong surgery. I think this is one of the things we take for granted, and we take it lightly because we think, oh, they always know who you are. Remember, hospitals have 1 million people coming in and out of their care every year, so they always have an issue. They might have an issue around finding who you are and whatever. I know there's actually a series I watch which is called, I think, Jane the Virgin, and something similar happened to her where she was sort of mixed up with someone else. Her identity got mixed up, and that's a little bit of something that has happened before. So you have to make sure that your identity is not mixed up. Look at your wristband, which usually has your name and your date of birth and that kind of stuff, and make sure that it's checked and verified before every medical procedure, especially if it's going to be heart or a surgery or any kind of situation. You just need to make sure that it is you, and they know it's you, and they know who you are. Another one is that I found very important is fake doctors. Sometimes there are con artists that pretend that they're doctors, offering medical treatments that make them rich, but will only make you sicker. There's an example of Serafina Garling from America, who wore a back brace advertised online by a man found guilty of insurance fraud. And Garling thought the brace would help with the sclerosis, but it only made the condition worse. So make sure that any health practitioner you receive treatment from is in fact qualified to do so. Another really crazy one is lost patients. Patients with dementia or other mental disorders can wander off, get lost, become trapped in closets, and even die from dehydration and other hazardous signs. And we've seen this actually with the Lifebouy incident, where I spoke about it at length for weeks and weeks and end because it was so scary for me. But you find that a lot of patients can be treated even badly, although they do have some sort of mental disorder, and dehydration can lead to death. So it's very important that, first of all, you have a GPS tracking bracelet, or at least someone knows where you are. But two, that wherever you are, it can help you sort of get better. It can help you. It's actually a certified clinic. It's a certified space, and you're not just in a space where nobody knows what you have and nobody can help you. No one qualified can help you. We have to make sure that we don't have lost patients. Also, there's air bubbles in blood, something that I also heard about quite recently. If the hole in your chest isn't sealed correctly or airtight, after a chest tube is removed, air bubbles can enter the wound and cut off blood supply to your lungs, heart, kidneys, and brain. So this is a life-threatening event. So before having a chest tube removed, ask the nurse how you should be positioned to avoid air bubbles, and to make sure your hole will be sealed airtight. And operating if you're being operated on, you must make sure it's the right body part. You have no idea how many times people have had their body parts not being operated in the right space or in the right way. They're looking for the wrong thing. There's so many complications that happen with just a mismatch of communication, information. So always make sure that if you are in hospital and you are getting treatment of any kind, that you are responsible enough to say, wait, let's check. Is it me? Are you sure it's me? Do you have the right records? Because we don't want anybody dying at the mistakenly, or getting something removed mistakenly, and having to live with it for the rest of their life. So many deaths that could be prevented from just being a little bit more cautious. And I know it's not your job. I know that you are there to be treated. You paid your money. You're there, to be treated well and to make sure that they do their job well. But it doesn't change the fact that 250,000 people everywhere die from medical errors. And I think it's very important that we start looking at how we can be a little bit more, of our own patient advocates. And I think there's so much that you could do on a daily if you are in hospital for long periods of time. I know it's tedious sometimes, but you want to make sure that every single day they know who you are, they know who they're serving, and you know exactly what's going on. There's labels around your bed. I know that they're doing that now in a lot of the hospitals to say, this patient has this patient has that. Sometimes you're so tired and you're so drugged up that you can't really, and drugged up in obviously by whatever condition you may have, that you can't really double check whether or not they know, whether or not what it is that you've been treated for. So it's very important that you make sure that whatever sign is on your head, whatever is written down, you kind of have an idea, or you have a friend with you who can help you. Also, in the ER waiting game, emergency rooms in hospitals only have so much space. So when beds are full, it can mean you're forced to wait for medical care. And that wait time can sometimes be the difference between life and death, or the loss of limbs, as happened to a lot of people. I know of a lady whose name is Malaya Jeffers, who had whose baby, who waited 5 hours for medical care with flesh-eating bacteria spreading through her body. You cannot wait for that long if something like that is happening, if that kind of pain is happening. So make sure that, whatever emergency it is, you let them know that this is what's happening. I need the attention ASAP. And if you don't get it there, try get it somewhere else. You cannot be waiting forever trying to make sure that somebody, takes notice of you. So make sure that that doesn't happen. Infestation, I've heard about this. I've seen it. I've had family members who have gone through this. So hospital acquired infections are alarmingly common and are sadly very deadly. I know that in the United States, more than 2 million people are affected by hospital-acquired infections each year, and a whopping 100,000 people die as a result. According to 2011 Health Grades Hospital Quality in America report, approximately 40 million Medicare patients' records from 2007 and 2008 show that 1 in 9 patients developed a hospital-acquired infection. And the saddest part is most of these cases would have easily been prevented with better infection control in hospitals. Simple routines such as doctors and nurses washing their hands between each patient, for example. Be aware and make sure doctors, nurses, and often healthcare providers wash their hands before touching you. If you feel uncomfortable speaking up, realize that doing so could literally save your life. And it ties in again with our premise for the show, which was speaking to the assistant brand manager of Lifebouy, who was going to let us know a little bit about the routines that we could go, that even doctors forget to wash their hands. And it's such a crazy phenomenon for me, because if you're touching people, you're holding them, you're working with blood, you're working with infections, you're working with a lot of really dangerous body parts, and body parts that are easily that can have easily transferable diseases. How come you're not washing your hands? It makes no sense. But you find that in a lot of hospitals, especially in really disadvantaged areas, disadvantaged communities, you find that washing hands is a luxury. Finding water to wash your hands is a luxury. So you find that doctors are compromised. And yes, you can say they wear gloves, but I mean, at the same time, even if you are wearing gloves, even if they are sort of protected in terms of their own hands, those gloves could harbor infectious diseases. So it's very important that we wash our hands. It's very important that we realize that this is what we use every day to talk, to engage with people, to type, to eat. We have to make sure we are clean. We have to make sure that we are in control of our of the germs that we are in contact with, and we are in control in some way, so that we don't infect anybody and we don't cause unnecessary harm to anybody. We are unfortunately having a lot of difficulty speaking to Mohammed. I don't know if it's a technical glitch on his side or our side, but we will definitely get him back to talk a little bit about Lifebouy and the brand as a whole, as well as the success of Lifebouy hand washing campaigns, how they integrate families, these strategies in making sure that it's memorable to wash hands, making sure that it's something that's a 20-second activity that you remember, and also just sort of the social responsibility initiatives that they're going to have for 2017, what's happening with Unilever, the whole gist. We're going to try and get a hold of him and then make sure that you hear that conversation, because I think it's an important one when you think about so many areas of life that are affected by making sure that you are hygiene friendly, that you are actively washing your hands before and after you do anything big, whether it's a meeting, you're meeting someone, you don't know what germs you are come into contact with. Wash your hands. It's cold, I know, so it's going to be, I'm sure people are not going to do it as much as they should, but you have no excuse to wash your hands before you eat, after you eat. Show your kids, make them learn from your example. Show your people at work that you wash your hands. Be clean. If you don't have that, find a hand sanitizer. Make sure that you are operating in a clean environment. You are healthy. You are making your strides to make sure that everybody around you is not susceptible to whatever germs you have contacted. Remember, if you are in public spaces, you are contacting some sort of germ. Opening and closing a taxi hand, oh my word, I'm just thinking a taxi door, going down an escalator, money, there's so many times where you find yourself exchanging germs and that kind of stuff. But anyway, we will get Lifebouy back on the line soon. Hopefully tomorrow we'll have that conversation for you. Thank you so much for listening. It is me, Vue Kyolwana, reporting for Social TV. If you have any queries or any questions, please don't forget to go to www.social-tv.co.za, and I will be there with the necessary experts and the necessary person to help make sure that your questions are answered. Also, if you'd like us to cover any of your CSI and CSR events, please don't forget to just DM me or talk to me on Twitter. Let me know about your event, and we will come and cover it, and we will talk about it, and we will engage you, and we will make sure that it has the necessary engagement with the necessary CSI managers, necessary social entrepreneurs, social responsibility, NGOs, and disadvantaged community at large. Thank you so much for listening. This is The Social Show.
brandlive.co.za